ladies of the League of Chiropractic, and I'm the Vice President of Programming for LCW. I'd like to thank you for joining today for the LCW Webinar Series. Our theme tonight is Create Value, featuring our guest speaker, Dr. Amy of Chiropractic Women is an organization for by women, inspire and support women in predictables and practice of principles of chiropractic relaxation perfection. For anyone who is not already a member, we in our mission of empowering women in chiropractic worldwide. By becoming a member of the LCW, you can connect with like-minded women in chiropractic at live events, at chapter meetings, and through our and the LCW Haas Facebook group. All are welcome to join LCW, including chiropractic students and more. Because together, stronger. Now let's get to the web. It is my distinguished honor to enter. She is a 2000 graduate of Life University, currently practices in Nashua, New Hampshire, and her name is Dr. Amy Haas. So ladies, I introduce you to Dr. Amy. Hi there.
Hi.
How are you tonight?
I am terrific. I just had a full day of adjusting people, and it's been a good day. How are you doing today?
Fantastic.
Good.
Doing in the practice, so busy is good and busy's going around. It seems everybody's offices were busy today. So if you're watching and your office was busy today, 2 thumbs up. If it wasn't, just know that it can be tomorrow. Help you get there, right? Value for chiropractic. So I'm going to ask you a little bit about and how you got to be a chiropractor. So talk to us a little bit about your pathway to becoming a chiropractor.
I had a prior career in science, and I decided that was just not what I wanted to do for various reasons. And about the time I was making that decision, chiropractic care came into my life and helped me a lot. And I decided that was something much more worthwhile to do with my time in my life. And therefore I discovered my passion. Decided to go back to school and started Life University in 2005. I don't know where the years go. I really don't. 2005. Graduated in 2009, did an associateship in Woodstock, Georgia with Dr. Eric Richards, and then moved north to Nashua to start my own practice.
Fantastic. Now I'm going to be teaching us how to create value in our offices for chiropractic, and specifically how to create value in the minds of our patients. So what you see is one of the biggest challenges we face as a profession.
I'm so sorry. Can you repeat, please? That broke up.
Sure. Our focus for tonight is creating value for chiropractic. And I know that you want to talk to us about one of the things you see as a challenge for our profession in getting our message across to the public.
Mm-hmm. Yep. Creating value in chiropractic. As I have approached the profession of chiropractic from an outsider, from the perspective of a critic looking inwards, I have noticed some things that I think could help us grow as a profession. And the first is how we represent ourselves to our patients, to our public. And this is something we all know as a profession. But the question is, how do we do that? How do we create the value that drives people into our doors and makes them want to come see us and understand what we provide to their lives? And there's many different ways to do that. The traditional way is to talk about the big picture, talk about the idea, the story. And that is wonderful. And I think it's time that we as a field start to add on to that and start to use the science that really does back us up as a profession as a tool to help people understand and an easy to understand level, normal physiology and how our adjustments guide a person towards more normal physiology.
Now, I know you talk about bringing people to understand is that we do. starting with the patient exams. So talk us a little bit through some of the tips to help patients come to understanding.
Okay, thank you. I'd love to do that. I'm actually going to preface that discussion because I do my new patient exam in a very different way than most people would expect. I'm going to preface this by saying I have had to. I opened a solo cash practice. I had no monetary backing. It was do or die. And my decision was to run a straight up subluxation model from the get-go. So you can hear from that since day one, I was having to create value. So I spent a lot of time thinking about this question, and I'm nowhere near where I will be. And I've learned so much from so many of our mentors in our profession about how to phrase things, how to talk with people, what discussions to handle objections, and how to guide people down a decision pathway. And I'm not going to name all my mentors, but they're all wonderful. It's a fantastic profession that we can guide each other, like what we're trying to do this evening. So that said, I have been fairly successful in creating a location and correction of vertebral subluxation model cash practice. And my PVA at this point depends on exactly how you, whether it's from 0 to now, I think it's about 70 or 72. So that tells you that the people are sticking around for what it is that I provide. And I actually had a fantastic afternoon today when I saw a bunch of my, I won't call them old folks, but old folks, people who've been with me right from the start. And to me, that is the mark of a successful practice. It's not how many patients you bring in, it's how many patients you keep. And the only way you can keep patients is by continually providing value. So that is my background, why I'm so interested and passionate about this idea and sharing this with other people to help shift perspectives towards that value-based service. So my new patient exam, as a former recovering scientist, my brain always wants to see, what is the objective proof? What does normal look like? What does abnormal look like? Where am I on that scale? Is the chiropractic adjustment something that can shift me on that scale from abnormal towards normal? What can that do for my health in general? So what I want to know is objective outcome measures, such as surface EMG is one, paraspinal thermography is one. I think we're all very familiar with MyoVision, NeuroInfinity, or the CLA software, the subluxation station. I also like balance testing. That's a particularly favorite of mine recently. Heart rate variability. And there's a series of active tests that are not orthopedic tests, but rather more chiropractically based tests, that my basic pattern is this. Do a measurement before an adjustment or before a course of care to establish what is a patient's baseline. Where are they? From multiple points of view, not just one or two objective findings, but several. And what I tell patients, the reason I'm doing this is that to properly appreciate the detail in the Taj Mahal, you can't take one photo. You have to take a whole series of photos. Each of those photos will show a little different perspective and a little different level of detail. So it is not one test or another that determines whether a person has vertebral subluxation. It is all the text in the context of one another. So we get a baseline on a patient on metric A, B, or C. You could also use heart rate. You could also use blood pressure. There are a lot of different things. And what I do is I express this to a person, not as I'm measuring your blood pressure, but rather I'm checking to see where your physiology is. And we're going to deliver an adjustment and then see how the adjustment changes your physiology. I'm not changing your pathology. I'm not changing your disease state. I'm looking to see whether creating freedom in the nervous system can improve your physiology. So when we do our new patient exam, we do x-rays because that is a very clear, objective way to assess what is normal versus what is abnormal, what is correctable, what is not correctable. And then we do these other tests. And then in the course of an adjustment, many of us have been taught to use leg length as an indicator. I talk about that with my patients on a day-to-day basis, and I use two other tests that I found very helpful so that a patient can feel the changes of the adjustment, every single adjustment. So they know when they walk out that door what has changed and what has improved. Two of those tests are actually very simple. With a patient prone on their tummy, you can do a leg flexion test. The simplest iteration is, are the legs equal on that leg flexion test? They should be. You're just stretching the quads. So if they're unequal, that is a marker of distortion in the frame. You deliver an adjustment and you remeasure. If that changes, you have shown the patient that the adjustment you just delivered changed their body. In that step, the very simple formula: baseline, intervention, remeasure. If you can do that repeatedly through a course of a person's adjustment or through the course of their care, the person's brain starts to go, something's changing here that I can see, I can feel, I can measure. And when you approach care in that way, it transforms, it adds to the story, because we all love the story, absolutely. How can we bring that story to a level of value that someone can really chew on? If someone's blood pressure was 160/100 before their adjustment, you deliver an adjustment, 5 minutes later, you remeasure their blood pressure, it's 120/80. That person knows that the adjustment corrected their physiology. You have just delivered value to that person, and that value is called the chiropractic adjustment.
Fantastic. Now, in your practice, are you doing these pre and post checks on every patient, every visit? And do you find value?
Many of them, yeah. Most of my patients find that really fun, actually. The leg flexion test. I also do a Jonda leg extension test. That's particularly fun because if a person, if their tensegrity structure is compromised, they will be unable to, from a prone position, easily lift either leg off the table. And when you deliver an adjustment and correct that, they know that they've gotten something out of their adjustment that is not necessarily the popping noise. They've gotten a measurable improvement from their adjustment. So those are two tests that I do on a daily basis. At that time, I'm also talking tick with every single patient. The way that I do that is based on Chestnut's model of the physical, chemical, emotional stressors. What I do is I lead people to understand how subluxation and distortion in the biotensegrity structure is literally an internal stress on the body. And then I turn around and say, we all know stress is bad, right? So let's reduce the physical stress on your body as measured by A, B, or C. And then we reduce your stress level. So you know you're automatically healthier. And then you go and reduce those metrics, whether it's the leg flexion, the leg extension, or they can turn their head better. And then you connect the physical changes to the health changes. Or if you want to do heart rate variability before and after, that's changing. That's one of my favorites. Connecting the person to a neurological outcome, which I think is something we as a profession should absolutely be doing. If not on a daily basis, then a pretty regular basis.
So connect us through the conversation for those docs out there who are watching and saying, okay, well, I do leg checks, but I don't do the prone leg flexion. How do I relate this not just to, well, of course I'm able to bend my knees more because you just adjusted me, but how do I relate that to overall function and improvement in health and physiology?
Thanks for that question. Totally fun. I had an engineer on my table. I love engineers because I can talk with them at a whole different level about the structure of the body and on the impact of distortion, subluxation on the nervous system. So what I did, there's a different finding on the leg flexion test that's a little bit subtle, but when you see it, you'll know it. When you pick up the ankles, they should be very light. If you just prop them up with your fingers. They should be very light. If there's not, then there's tension on the whole body. Your whole body's just going, and that's a measure of stress. I think we would all agree with that. So what I'll say to a person is, we're a little bit casual in my practice. So what I said to him this morning was, dude, Matt, your legs, they're not that big. They're really not that heavy. And then I reflect at him and I say, your legs feel heavy because your whole body has excess muscle tension because your nervous system is jacked up by all of these subluxations that we found in your spine yesterday. You remember those findings on your x-ray where we compared normal versus abnormal. You remember your heart rate variability where we clearly showed you your body's under stress. You remember the distortion pattern on the surface EMG. That's a lot of irritation in the system there. And that's being reflected as muscle tension. So if that is the case, then the chiropractic adjustment should help the body to restore a normal level of tension. So let's do the adjustment and see what happens. And it typically, I personally think that heavy leg feeling is due to cord tension. So what I find is one of two things, either if you adjust sacrum or if you adjust atlas and you go back, don't change anything else, go right back to their feet, lift their legs again. If their legs are lighter than nothing doing, that is a home run every single time, provided you set it up right. At that point, the person knows that their body was under tension, under stress. They know that they got adjusted, and they know that after the adjustment, their body all of a sudden relaxed. So that there you're connecting. It's more than a biomechanical phenomenon. There's something going on with the central regulatory mechanism there.
Fantastic. So tell us a little bit more about how you, once you go through the initial exam and you talk them through during the office visits or the adjustments, how do you maintain that conversation? You said you have TikTok at the tables. How do you suggest that the doctors that are watching maintain that conversation to keep the patients coming in? Because I thoroughly and wholeheartedly agree with you. Getting new patients is not where it's at. And unfortunately, there's so many people out there trying to teach doctors how to get new patients. We don't need to get new patients. We need to keep the patients we get. So having a high PVA is the utmost of importance, I think, if we really want to change the profession and change the impact we have on the world. So how do you suggest that doctors have an ongoing conversation that you found works so that they can increase their PVA?
One of the things that I've done is I repeat, for example, the heart rate variability testing at 30, 60, 90 days, 6 months, and whenever we feel like it. When the person understands that heart rate variability is a reflection of nervous system balance and efficiency, they want that. And if they have an abnormal reading when they first come in, and that starts to get a little bit better, then a little bit better, then a little bit better, and up towards normal, they're understanding that whatever's going on in their body, something is definitely improving. The nervous system function is improving. So that's one way, repeated testing to objectively show someone how their physiology is improving as a result of your care. The other thing that I do, and this is not particularly easy, we have to have a pretty good memory to be able to do this. I'm very fortunate that I do. I will carry on a continual conversation with each patient visit to visit, rather than straight up TikTok. For example, Matt, my engineer, he came in today. He had some fantastic results, absolutely fun. His whole body tension went away. He was able to breathe deeper. He could lift both of his legs better. His hearing improved, his vision improved. He had the classic first adjustment experience. And because I set that up and basically led him to understand what was going to happen so he could trace along with it with me, he knows what his body responded to the chiropractic adjustment. When he comes back next time, the first thing I'm going to do is put him on the table and say, hey, you remember with your first adjustment, we had your legs felt really heavy because your nervous system was jacked up. So we're going to test that again to see where you are. What that tells him, I'm looking at him. I remember him. He's not just a number on my table. I'm concerned with his findings. So if you pick one or two little things like that, and then you restore that to ease and say, hey, that happened just like last time. Okay, your body's responding really well to these adjustments. That seems, the continual conversations is one thing that I do on a day-to-day basis to let patients know that they are unique and I am thinking specifically about them.
That's such a big part of what we do. I think that as chiropractors, we have a tendency to build relationships with our patients and with the people in our community more so than other professionals, probably because we do see our patients more frequently and for a longer duration. You know, we don't just see them once every 6 months to clean their teeth, and we don't just see them once every 3 months if they've got an ear infection. We see them on an ongoing basis, but we become part of their healthcare team. We become part of their lifestyle. And I think that as we get to know our patients, what you said is so important. They are never just a number. They're not just the next person on your table. They're not just a number on your sign-in sheet. They're not just a number on your books to brag about at the next seminar. They are a living, breathing human life who has a family who depends on them, and coworkers who relate and interact with them, and stressors in their life that, you know, come onto them every single day. So having that personal touch, I think it's important to develop that. So for those of you that are new in practice, it's important to develop that early on, but it's important to maintain that even when you get to higher numbers, busier practices, bigger volume. It's important to maintain that and not get to the point where you don't even know who's under your hands, right?
Mm-hmm. Yep. I could not agree with you more. Mm-hmm.
Yeah. And I think that's one of the finesses about building a good, strong practice, is knowing how to maintain those relationships, knowing how to still deliver that same level of caring and concern for people, even when you get busier in your practice. I was always taught, don't give somebody 30 minutes of your time right now because you're not yet busy. Because when you get busy and you only have 15 minutes, they're not going to be happy. And then when you get really busy and you only have 5 minutes, they're going to be really upset. And then when you only have 1 minute for them, they're going to feel like you're neglecting them. Treat them as you would treat them when you're busy.
Yep. And always, when you are with them, have laser focus. They know you are 100% on you. Because I can't remember what the source is for this, but patients, my understanding, if you really have your focus on them, will not be able to tell whether you spent 1 minute, 2 minutes, 5 minutes, 10 minutes, or 30 minutes with them. All they feel is that someone has really, really spent time with me. So yes. The time, 30 minutes, I agree. If you spend 30 minutes with each patient, you're going to shoot yourself in the foot because you're training them to expect that. Bad idea. Been there, done that.
You know what? But I think most of us have done that, maybe not to that extent, but we've done that in some level when we started out in practice, because in school, we learn to spend an hour or 2 hours with a patient every visit. And then when we start our own practices, or we start working under someone that's not a busy office, or we're seeing our own patients in somebody's offices, I think a lot of new docs fall into that trap of, well, you're the only person I have for the next 30 minutes, so I might as well talk to you because that will help me build value. And in essence, it's doing the exact opposite. It's not building value. It's making them think, you know what, I'd send my friend here, but they don't have this kind of time to waste.
Right.
Or they think, you know what, if I send my friends in, then you won't have that much time to spend with me anymore, so I don't want to send referrals in.
Right. Yep. Mm-hmm.
So you've made that mistake in the past. Talk to us about how you realized you made that mistake and how you overcame it, because there's somebody listening right now who's stuck in that and maybe doesn't even realize they're stuck in it and needs to overcome it like you did.
I have had so much help from a lot of different mentors. This has been a struggle for me, as I'm sure it is with many people. How do you cut off a conversation? How do you politely cut off a conversation and walk away? Not easy. There's the classic clipboard method. Start looking down at your clipboard, which is next to you, and start saying, that is a great idea. I would love for you to email me about that. And you are all set today. I will look forward to seeing you on Wednesday. Short and simple. Other possibilities include the phone call from the CA. That's not one that I use. That's up up the sleeve if we really need it. Another one is making sure to have a defined endpoint to any given adjustment. So for me, is I will recheck their leg flexion, recheck their leg extension. I'll do a quick Thompson check from the end of the table, and I'll look up and I say, "You're good. We'll see you next time." Dr. Eric had a great way of putting it. He would, every time he would finish with someone, he would just say, "Good stuff," and walk away. It was really very effective. The person feels cared for, they feel loved, they know they've gotten what they wanted because the doctor has checked their work, and they're good. Yeah, there's always going to be a couple.
Right. I'm glad to hear you say that about the definite ending to the adjustment, because a lot of you that are watching, you are peak doctors, or you take on preceptors or interns from some of the other schools. And when you have those students that are learning, sometimes students forget that there's a beginning and an end to the adjustment. So they might do a leg check before, but they forget to do the leg check after. And that is, it's a way of showing that we check our work. So I'm a big fan of a leg check, adjustment, and a leg check to show that we're done. And I think when you do end the adjustment very clearly, our time here is done, it does help to stop that conversation that could continue on. So I like that you kind of have that ending, like our work here is done, we're all set. One of the tricks that we always use is I use the computer, the touch screen. So as soon as I get them up off the table, I throw their paper in the garbage. I walk over to the touch screen and I start touching. And then I've got patients on the other side of the wall. So it's just time to, all right, we'll see you in your next appointment. And I just walk around and finish up their notes. So for those of you that are struggling with that, understand you are sometimes not creating value when you spend too long with a patient. And obviously different techniques require a different amount of time. But if you're filling space because you think that that's going to help them fall in love with you or see how much you care, you can deliver all the love and caring and all the service and all the giving that you want in whatever time frame you decide without having to give extra time to fluff it up, right?
Agreed. Wholeheartedly. Yes. There was something you just said that I absolutely love, and it is one of the best ways in the world that I think we can provide value to our patients. The post-check. I actually refer to it also as proofreading my work. So when I go back to the end of the table and I'm doing a basic Thompson check or something like that, and someone asks me, "Why are you doing that?" If I literally say to them, "Oh yeah, I'm just proofreading. Everything turned out good." You have instilled so much value in that adjustment. And you have shown them that the adjustment is much more than the product of the popping noise. There's an effect you're looking for.
Very good. I love it. Now take us through, how can someone more effectively do a reevaluation? Because oftentimes I have doctors say to me, and I'm sure you've had the same thing, my patients come in and they're all excited, but then they get out of pain and they think they're done, or they start asking the front desk, "When am I done?" Right? "When am I done here?" And that typically happens when we don't communicate what it is that we do. For me, the re-exam is a time to bring them back to day one and remind them of all that has improved. But it's also a time to really build them up to the next level of care. So how do you continue to build value during that reevaluation so that people get that mindset that this is not just about my headache or my low back pain? This is about their body's physiology and functioning at a better level.
That one goes to, that's a hard question, and thank you for that. That goes to the hot button question. When you do an exam on someone, they come in for neck pain, headache, whatever the heck brings them in, that's wonderful, but there's a bigger picture to it. And you need to find, what is that bigger picture? Okay, you have headaches. What is that stopping you from doing? What do you love doing that you miss, that you can't do anymore? It's really affecting your life. How could your life get better if you didn't have X, Y, or Z, if your body worked at a higher level? How could your life get better if you slept better because your body was more relaxed? If you were able to move better so you could hike better and get healthier cardiovascularly? So the first part of that question is finding the hot button and communicating about that clearly with the patient on a day-to-day, week-to-week basis. And again, that you can write that down, but it's a lot about memory. So one of my patients came in, another engineer, I seem to specialize in engineers. He had a running injury, which was preventing him from doing his best. And so I'm like, okay, that can't be very much fun. So what's that stopping you from doing? He's like, I ran a marathon. There's no freaking way I can run one again. Are you kidding me? And me being the evil person that I am, looked him straight in the face and said, want to bet? So that was a risky bet, and I get that. Given his clinical presentation, I was confident that he would be able to do whatever he wanted to do. This past weekend, he had the opportunity to test his resilience. And that's one thing that I really drive home with all my patients. Health is not about just feeling good. Health is not about sitting on the sofa. True health is about your body's ability to adapt to whatever stressors you're going to put on your body. So when you raise that bar for patients, and they're like, okay, she really does expect me to go out hiking. Yeah, I do. And then you listen to their stories and say, you know, for example, my engineer person, he is running again, and he's really enjoying that. And he really understands that his body is better able to handle that stress. His body is also handling the stress of his job better because his mood is better and his sleep is better. And we all know those are things that improve with chiropractic care. I have another woman who came in with massive lung issues, and the doctors did not know what was going on with her. And turns out she was subluxated right around T10, which was interfering with her diaphragm and all of the nerves that go into the lungs. A year later, she hiked up Observation Point in Zion, and she emailed me because I laid this out and I said, okay, this is something you miss. I know you love hiking. Let's get you back there. She emailed me from the base lodge and said, I can't believe I just did that. So that is someone who really understands that the program of care that she has done step by step, these little incremental changes that all add up to improved actual function, health, adaptability, and resilience have enabled her to take a step forward in her life to something she never thought she could get back to. So that's what it really means to her. Does her lower back pain mean anything to her anymore? Yeah, a little, but it's more the bigger picture.
I think when you tap into what really matters to people, you talk into their value system, as I always call it, you have a better way of communicating with them because you're not just talking out here arbitrarily about something that matters to you. You're talking directly into their value system. So whether it's wanting to be able to hike again or play with your children, when you find out, I like that you call it the hot button, I call it their value system. When you find out what really matters to them, you know, what is this problem preventing you from doing? Now you're able to structure your conversation around their needs, their wants, and their desires. And I have to agree with you. That is, if we're going to talk about building value for what we do, then we can't just talk about what we want to talk about anymore. We have to understand. I always say, meet people where they are, right? They're going to come in with some complaints sometimes, meet them where they are, but bring them into what they need.
Yeah.
And I love that you do that. I think that's great.
It's fun.
So I always like to ask about some wonderful stories that we have in the practices because, look, the reality of chiropractic, those of you that are chiropractors watching, or if you're a chiropractic student, you probably are aware of this. But for our spouses and our CAs who are watching, you might not realize that. But the very first chiropractic patient did not have neck pain or back pain or low back pain or shoulders or aching. He was deaf, right? And then all the patients after that were not just deaf patients, but they also were not just low back and neck pain patients and headache patients. They were patients with very serious conditions, heart conditions, lung conditions. We all know the story about the 1918 flu pandemic. So I like to see chiropractic brought back to what it really was meant for, and that's to help the body express its fullest potential. And that means getting sick people under our care. So no webinar is complete without talking to you about some of the miracle patients that you've seen in your office. And let's face them, they're all miracles, but let's talk about some of the ones that you've experienced.
I'll tell you about my latest favorite one. And this is the third of a series. This third one, the first one came in and one adjustment, it's kind of a funny story. She was, I think, my third adjustment in my own practice. And I had apprenticed for a year with Dr. Richards, so I felt I had basic skills, but this is my actual third adjustment in my own practice. And I do a very simple C6 modified rotary brake supine, and she started sobbing. Do you mind if I swear?
Yeah, go ahead.
scared the living fuck out of me. I'm like, I'm done. Holy crap. Holy crap. And after a minute, and this is someone who I brought her in for straight up location and correction of vertebral subluxation. So she was familiar with the story. And importantly, she knew there was more to look for than back pain or neck pain. There was a bigger picture to it. So when I did that adjustment and she calmed down after a minute, she's like, I don't know what the hell you just did, but the cloud in my head is gone. The anxiety is gone. What did you do? And I've had 2 other patients like that since. That changes someone's life. Without any doubt in the world, that will change someone's life. My latest one that came in with GI issues. She's very constipated, and she was referred in by her sister, who's a nurse, which is kind of always a fun referral. And at her 3rd adjustment, she's like, life is possible without anxiety. I had no idea how these subluxations were irritating my system and causing me to be so anxious. And now I understand that the body should be more in a state of ease. She used those words and I went, more ease. That sounds like a good idea.
Right.
Yeah. So those are a couple of my fun ones. There's always sorry, go on.
No, go ahead.
The kids who come in and they've been sick all their lives and they've been on asthma medications, and you do the simplest thing. You restore ease to their body and they stop getting sick. And you watch them blossom. You watch their moms be able to relax. It changes their whole family dynamic. It changes the trajectory of their future by doing the simplest thing, identifying where the body is stuck, where it's subluxated, and restoring ease, and recognizing and respecting that the body knows a lot more than we do about what it should be doing. So we just enable it to do its job.
I love what you said earlier. You said, I'm checking your physiology because I want to see if we free up your nervous system, if your body can improve its physiology. And that's a way that I see doctors out there being able to connect people more to function. It's not about how you feel. It's about how you function. It's not about how you feel. It's about how you heal. It's about your physiology. I like that conversation and the way that you had that. So take me to a situation of a patient who says, doc, I'm good. I'm feeling better. I'm good. I'm not having that pain anymore. Have you experienced that? And how are you able to handle that for those doctors that are watching? How can they handle that as well?
That is an interesting question because I please understand, I'm not a arrogant person. I'm just not. I realized when you said that, and this is a very normal conversation at the front desk. So when am I done? We don't have that conversation here. We don't, because of the way that we do things. We set it up and we continually provide that value. So patients want to keep coming back. It is actually very much a rarity when I have someone say, I'm done. And in that particular case, I let them go. I've given them their options. It's not for me to decide what's best for them. So I say, okay, I understand that this is where you are right now. Please know that the door is open if you want something more for your health and for your life. Be well. That's about it. I don't like fighting people. I would rather make sure that they want to stay from the start.
And I think when you build value, as you're talking about, I think those conversations, like you said, it's you're not being arrogant. You're just saying those conversations just don't typically happen because you're providing the information that they need to make the decision to choose to continue under care on an ongoing basis. So if they're not sitting there going, I don't know why I'm coming in, you're constantly providing that value for them, constantly having that conversation. Yeah. So I would be remiss if I didn't ask the question that, of course, everybody always has. And that's the question that everybody in the profession always has, which is, of course, how do you get new patients? But I know for you, the focus is on keeping those new patients. We've got to attract them. We've got to retain them. Somewhere along the line, we have to educate them to retain them. But when you were starting out or even now, how do you go about attracting new patients into your office and into your model of care? How can the docs out there benefit from your experience?
My early experience is very, very different than my experience right now. In my early experience, I remember being sent out for the Maximize Living kiosk at the mall in Woodstock there. I forget what it is. And I manned the kiosk for Dr. Eric. And it was not the most fun experience. I understand why I did it. I totally get it. So we've gone from that perspective to doing women's health fairs, health talks around the area, and just, kind of my favorites were the farmers markets, actually, because that's an environment where I'm going to be very comfortable. When you're comfortable, you're going to talk better. You're going to communicate better and connect with people better. I think really, by and large, the two most effective methods for getting new patients are Google reviews and referrals. So Google reviews, that's an interesting point, because these days reviews may not mean as much as they used to. I'm sure we've all seen on Amazon the robo reviewers, but what your patients have to say about you, if they're saying something that's not just, she helped me with my headache, but rather, I sleep better because I see Dr. Amy. My mood is better. My anxiety is better. My doctor says my blood pressure is down and I no longer need medication. And oh, by the way, my headaches are gone. That's nice too. And if they can talk, and talk about their experience in my office and say, this is a great place to go to because it's a relaxing environment and they really do care about you as a unique individual and they're invested in seeing you get healthier. And if you have your patients represent you that way in a public forum, whether it's Google, Facebook, I wouldn't use Yelp because they're not chiropractor friendly. A whole different story. So if you get your patients to speak for you, that is one of your best methods for generating referrals or generating new business. As far as referrals, I've always worked on a very simple model. Do the right thing and people will talk, and be patient. This engineer is a husband of a patient. He came in for her initial consultation where we just sit down and say, hey, what are you looking for? Am I the right fit for what you're looking for? Yes, no, maybe. If yes, then we're going to proceed with an exam. If no, send you on your merry way, find you what you need, and it's all good. He came in with his wife for her consultation about 3 months ago or something like that. And he was one of those, and I'm sure you've seen these. He was one of those, I don't believe you. I'm an engineer. I know everything. And I just kind of laughed. I went, okay, I'll work with your wife. And when you're ready, come on in. And I just kind of put it out there in the universe that, okay, he's coming in. I'll wait, whatever. I'm not desperate. I don't need new patients. He'll come in when he's ready. And because that's how men are. And that was the engineer who I gave him his first adjustment today. I'm really proud of the first adjustment that I gave to him because he, as an engineer, connected the bigger picture immediately, because I was actually able to take it a step further and say, I described a little bit of the wiring diagram that works really well with engineers. So it turns out the wires that go from your spine and the back of your head, the back of your neck, they go into the back of your brain, a place called the cerebellum. And it turns out the input to the cerebellum relays. The output from the cerebellum activates a bunch of things that I think you might find important, like blood pressure regulation, heart rate regulation, state of alertness and awakeness. So the input from your spine actually influences those things, among many other things, including the stress HPA axis. So what engineers really get is the input drives the output. And when you put it in that frame and then you just show them, you just improve the input. He put it together and it was so beautiful to see him do this as an engineer. He's like, holy shit, why did no one ever tell me this? And I'm like, I did.
Just did.
Yeah, well, you had to find it yourself. Totally cool. But he literally, because of the way that I led him along the pathway, he intuitively got the big picture, which was such a beautiful thing to watch.
And that's what we're all about, making sure that people get the big picture so that they can get connected, so that we can fulfill the big idea by getting the entire world checked and adjusted when necessary, right?
Yep, agreed wholeheartedly.
I love it. I love that you helped us build value tonight. Thank you so much for making your story relevant to all of us so that we can all go out and do the same thing in our practices.
Thank you for having me. This has been a very fun conversation. I've enjoyed sharing with you.
Thank you. And a big thank you from the LCW to Dr. Amy Haas for sharing such valuable information. At the LCW, we are committed to delivering high value for our members. We host free bi-monthly webinars the second and fourth Wednesday of each month. And we also hold our CA Connect calls every month. So if you're a member, you can access the replay anytime on our website. That's lcwomen.com. If you're not a member, you can access the live version, but you have a limited time to see that. So I strongly urge you to join us, become a member, and help us to really support more women in chiropractic to go out there and grow their practices. I want to let you know that we have a very live, exciting event coming up. This is an exciting live event in the fall. It's going to be in Arizona. It's November 3rd, 4th, and 5th in Scottsdale. We are having an experiential Spiz and Spa retreat weekend. It's in the picturesque desert. You get to listen to inspiring speakers, relax in the spa, and you'll gain implementable tips to help you grow your practice and your impact on your community. On behalf of the LCW, thank you so much for joining us tonight. We'll see you next time for more great webinars. And in the meantime, go out there, ladies, connect, empower, and thrive. Good night, everybody.